I'm Lee Thomas, sitting right next to Courtney for Fox Soul's Black Report. Now, studies have shown that Black women and people of color face significant obstacles in receiving a diagnosis and treatment for eating disorders due to racial biases in our healthcare system.
Yeah, and eating disorders, Lee, those providers, they may hold biases about their patients. Now, leading to a misdiagnosis or a failure to diagnose a problem at all. So cost-related barriers to care also exist for marginalized communities, making it crucial for eating disorder experts to reach out and educate providers on what eating disorders look like beyond the stereotypes.
Now, this week is National Eating Disorder Week, and Black people are often left out of that conversation. But not today,
not today,
not right now, and not here. Eating disorders are among the deadliest mental illnesses, affecting 9% of the total U.S. population. People of color, as you probably know, specifically African Americans, are significantly less likely to receive help or even seek help.
That's right. An important discussion here. It's the science and emotion of eating disorders and methods of prevention and intervention. Dr. Michael Knight is an assistant professor at the George Washington School of Medicine and Sciences right there in D.C. and practicing MD in internal medicine and obesity. We want to welcome you to Fox Soul's Black Report.
Thank you.
All right, looking good, doctor.
Thank you.
Yeah, indeed.
I was going to say, Doc, handle your business. It's good. First of all, it's good to see you.
Yeah, it is.
Yeah.
It is. All right, doctor, let's talk about the common types of eating disorders. I know we might hear a lot about anorexia, but there's a myriad of eating disorders, yes?
Yes, of course. And what people don't realize is that up to 28 million Americans in their lifetime will have an eating disorder. It's very more common than we believe, though it often shows up in young adults and young people, and mostly women more than men. As you've outlined, it could affect anyone from any socioeconomic, racial, or ethnic group. Yes, we hear about anorexia, which is one of the most common conditions. And in that condition is when someone really gets into a stage of being underweight, having less weight than is healthy, and in their mind believes that they're actually overweight, and thus restrict their eating to a significant way that it starts affecting their health.
Now, Doc, let's talk about some of the characteristics of an eating disorder. What can we look for? Because sometimes people are very good at masking some of the characteristics.
Yeah, so one of the things we have to understand is that there's a mental health component. So oftentimes someone who is prone to anxiety, depression, is going to be at increased risk for this. Some of the symptoms or signs is a preoccupation with food and the parents to a level that's a little bit abnormal, that it starts affecting their day-to-day life. Another common eating disorder is bulimia, where someone eats a large amount of food and then immediately or very shortly after will vomit it up because they have guilt that they've eaten too much. And so someone who is leaving the table after a meal and going to the bathroom, someone who is changing their lifestyle to keep up with this behavior. Those are some of the signs that we can start picking up. One of the key points is that you don't always have to be underweight to have an eating disorder. Another disorder that's common is binge eating disorder, and that's eating very large amounts of food but not throwing it up. So that individual may actually be overweight or living with obesity. And so it's something that we don't talk about. We know that there's stigma in our community, but also stigma in the healthcare profession that is a lack of recognizing these conditions in our community.
Yeah, so Doctor, you just talked about the characteristics, you just talked about the factors. Talk a little bit about, because for me it's a little confusing because it's categorized as a mental issue. Of course, that's affecting the physical. Getting a little bit into your treatment, how do you go about? Do you address the mental first and then the physical, or do you have to, get the patient to a proper physical state in order to treat the mental? How does that work?
Yeah, so number one, we have to make sure that the physical state is stable, right? Because in some of these serious conditions, someone's health can be in jeopardy to the extent of even death and hospitalization.
Right.
So first of all, we have to make sure that you're getting enough nutrition, that your body is functioning. And then we have to address the mental health component. One of the most effective treatment aspects for eating disorders is psychotherapy. So meeting with a therapist, a psychologist, someone who is trained trained in this area, cognitive behavioral therapy, which allows us to have interventions and strategies to deal with what someone is thinking that's leading to this type of behavior.
Doctor, food is so much a part of the African American community, feeding someone, eating food, and a lot of times when you have some kind of disorder, it's hard to diagnose. How often do you see African Americans at your practice, and what do you say to people if you think more than the patient itself, the family member that wants to help the patient? Is there some kind of outreach that can get that person the kind of help they need to talk to the family member to get them to you?
Yeah, one of the most important things here and the common things is that often people are in denial that there isn't a problem. Again, remember that increased risk for this can be anxiety, depression, but also stressors, social stressors. When we think about what we see on social media, in magazines, people have a lot of pressure for their body to look a certain way. So they believe that they're doing something right, but it's in an unhealthy way. And so it's having that honest conversation with someone and encouraging them to speak to their doctor because something is not right. Their health is changing. You know, for example, for many women who are dealing with anorexia, they no longer have menstrual cycles. A lot of their body is just changing. And so that's an opportunity to say, you know, I know you may think that everything's okay, but your body's changing, your health is changing. I'm concerned. Why don't we talk to your doctor about it and see if there's an opportunity to address an underlying issue that we may not recognize at this time?
Yeah, we've got about a minute and a half left, Dr. Knight. You mentioned social media. That's a whole nother element that, doctors may not have had to, didn't deal with, a couple of generations ago because it was non-existent. How important is that in your practice when it comes to healing and deprogramming those who are highly, highly influenced by what they see on social media? Is so dominant nowadays.
It's a huge, huge issue, particularly for our young adults, our teens, but for any individual. The reality is what we see on social media is often edited. And so you have individuals who are trying to compete with something that is not even real, body shapes that are not real. You know, our bodies change as we get older. Yes, we want to have a healthy approach to our weight and whatever level of the spectrum that it is, right? There's not one number that we all have to be at. But at the same time, we have to really think about health and also have to think about how much is social media a part of our lives? Are we spending hours and hours there? And is that really a healthy behavior? Is it affecting other parts of our life?
Yeah, I mean, social media is just the highlights.
Yeah,
it's the highlights. Quite often it's not even the real deal.
Yeah.
So I agree with you on that one, Doctor.
We only have 30 seconds left, and Doctor, to the people that want to be a Dr. Knight one day, sometimes I'm just proud to see people in the positions that you're in. You're a professor, you're an MD. What would you say to a young person who aspires to help in the way that you do?
Yeah, so I think the most important thing, as you've outlined, is you can't be what you can't see. So it's very important for our youth to know that wherever you grew up, I'm from the Bronx, New York, right? And so wherever you grew up, you can make it if you are determined and you have a mission and a vision for your life. And so connect with someone who can help you. Connect with someone who also believes in you, whether that's a teacher, whether that's someone at church in your community, and let them help you achieve your goal.
All right, preach on, Dr. Knight.
All right. And your next stop is the cover of GQ with that suit and that tie.
There you go.
Dr. Knight, we appreciate you so much.
Appreciate it.
You are now an official soulmate. Thank you so much for your insight and joining us today. And we want to end by saying if you are in a crisis and need help immediately, I want you to text NEDA, that's NEDA, to 741-741. That's NEDA to 741-741. Dr. Knight, we got to have you back. Thank you so much.
Thanks for having me.
Thank you. Great to talk to you.
Yeah, always great to talk to an expert who can give us some insight on a topic that, some folks might not be too familiar with, may have experienced, but might not be too familiar with in regards to how to get help and diagnose it.
And it's a tough conversation to have with somebody, and it's good to see him there, that you have some backing to get you that help.
That's right.